Oh, hello, it's Clozapine Vitamin D here again. Okay, so I want to go into part 3 now, okay, about anabolic androgenic steroid abuse and harms. Okay, so I didn't particularly feel that I went into enough depth covering harm of anabolic androgenic steroid abuse to the cardiovascular system. Right, okay, it is quite well documented that anabolic androgenic steroid misuse can cause significant harms to the cardiovascular system. So the first harm that I want to talk about are harms to the heart. Okay, if you, have enough duration of exposure to anabolic androgenic steroids, especially if they are continuously misused, okay, and the dose is high enough, is you can suffer what we call concentric left ventricular hypertrophy and also something called cardiomegaly. So what does this mean? What this means is that the part of your heart called the left ventricle, okay, which usually, okay, when it's not thickened, okay, so it has a thickness of about 11 millimeters, when the sinus atrium fires up, okay, is this muscle, the heart basically is able to essentially contract and squeeze, and what happens is enough blood, okay, is ejected from the heart, basically to be able to pump blood correctly around your body, okay? Now, what may happen here is if your left ventricle becomes what we call concentrically remodeled, so it thickens, okay, you now get something called congestive heart failure with reduced ejection fraction percentage. So, if your heart progresses beyond 11 millimeters of thickness, okay, so 11 millimeters to 14 millimeters is what we would regard as sort of preclinical thickness or mild concentric remodeling, okay, so what this may mean is that actually you may not even know you have, left ventricular hypertrophy, concentric remodeling of the left ventricle, until one day, you are just walking up a steep flight of stairs and you just can't do it anymore. In fact, lots of people who walk around with some type of heart failure don't even know they have heart failure until it's facing them right in the face because they can't do things they used to do. Now, also, I think, now I don't research this before the video, I'm just going off the top of my head, so I might be wrong about this, so don't quote me. The average heart is somewhere around 400 or 450 grams in weight, or mass rather. It's not uncommon for people who abuse anabolic androgenic steroids, okay, to have a heart that weighs in excess of 600 grams. And also, by the way, is upon enough duration and dose exposure to anabolic androgenic steroids, is you may actually now start to develop what we call fibrotic scar tissue formation, in the heart. Okay, it starts out as basically one cell line thick scar tissue, and it slowly infiltrates. And what happens is that scar tissue may now, over time, when it's accumulated enough, prevent that heart from contracting and squeezing normally. Okay, so this is particularly bad news. So you have impairments of the heart. Now please, if you're responsible, okay, and not taking any huge doses, and you get your organs, scanned and all this type of stuff, and I think it's called an echocardiogram, or electrocardiogram and echocardiogram, so ultrasounding of the heart as well as a 12D ECG. Is if you do start to develop this, okay, you may be able to, even though it's very difficult, but may be able to reverse this. However, okay, if you are not responsible with your use, okay, and what you do is you take lots and lots of anabolic androgenic steroids and the doses of them, okay, and you do not get your organs scanned, is, it has not been, unknown. I mean, it can happen, okay, that you may develop these problems after just maybe 6 to 12 months of continuous exposure if the doses are high enough. So this is actually, again, really serious. Furthermore, okay, is anabolic androgenic steroids can increase blood pressure, okay, and if you, for example, continuously misuse anabolic androgenic steroids and you have what we call a dysregulated lipid profile, okay, and also your body is inflamed, say through poor dietary decisions, like lots of people, so they can get their calories in to build muscle, okay, on anabolic steroids, resort to using junk foods. Okay, if your arterial membrane is inflamed, okay, you get this, what we call, with dysregulated lipid profile, hot plaque formation. okay, if you now have what we call turbulent flow in the blood vessel, okay, due to having high blood pressure and tachycardia, due to the central nervous system or parasympathetic, sympathetic, nervous system driving, sympathetic, not parasympathetic, it's sympathetic nervous system drive is in that blood vessel. You now may get what we call turbulent flow, okay, like little cap, that platelet cap breaks off, okay, you now get that hot plaque, coming out of that, endothelial membrane or the artery, and now you get a clot. Okay, as I said before, if that happens in your heart, in your coronary artery, that is a myocardial infarction, that is a heart attack. If that happens in your leg, okay, for example, that is a serious, femoral deep vein thrombosis, okay. If that dislodges, okay, it can travel, into your lungs and cause a pulmonary embolism. And also, even worse, okay, you may actually get what we call an ischemic stroke. And this is not funny, please, I have to touch wood, is ischemic stroke. Now that scares the shit out of me. I mean, you may be able to survive a heart attack. If you get medical treatment in time, you could survive a deep vein thrombosis. But if you start to get a stroke, okay, and you suffer a proper neurological injury, you're left a vegetable with maybe locked-in syndrome, okay, maybe you are blind, okay, you can't move maybe the left side of your body, you can't feed yourself, you can't dress yourself, you can't walk or speak. Mate, please, devastating, absolutely devastating. Anyone who has anything like this, please, has my absolute most sympathy, empathy and compassion. So what else? I'd like to go into, if anabolic steroids are abused, about what we call an increase in what we call red blood cell count, okay, and also an increase in what we call clotting factors. Now, I'd just like to discern the two, okay. For example, if you take, say, a big old dose of testosterone, okay, and a few months later your hematocrit is now raised to, say, maybe 52%, that doesn't maybe necessarily mean, okay, that you're at a significant risk towards, say, as I said, all these problems like ischemic stroke, heart attack, deep vein thrombosis, pulmonary embolism. Okay, you can have a slightly raised hematocrit score, like 50, 51, maybe 52%, and have normal clotting factors. Okay, this is called erythrocytosis or erythrogenesis. This is just an adaptation, because what happens here is your testosterone or androgens will now make your kidneys basically produce EPO, so erythropoietin, and the erythropoietin basically makes your bone marrow produce red blood cells. Now, if you have the slightly raised red blood cell count, so the hematocrit, okay, without the raised clotting factors, this usually isn't really that dangerous at all, okay. But unless you actually get the clotting factor blood test, usually you don't know if it's dangerous or not. So there's erythrocytosis or erythrogenesis, and then there's something called polycythemia vera. Okay, the polycythemia vera is very dangerous. Okay, what this basically is when you have elevated hematocrit, so lots and lots of red blood cells, more than what you'd usually have. Okay, and then you also have the increase in clotting factors. As I said, the increase, clotting factors, they are not usually, okay, detected in the blood test. You don't know what's what. Okay, so unlike, say, erythrocytosis or what's called erythrogenesis, which is relatively benign. Okay, it may just mean that you're a bit performance enhancing your endurance training. Okay, if you have the high hematocrit, okay, like 52, 53, 54%, okay, with the clotting factors, is now you are honestly predisposed to all these types of ischemic problems. And that may be actually, ironically, caused by how fit you are, okay? Because if you have a very fit cardiovascular system, okay, and your heart rate in your sleep gets to, say, 45, 55 beats per minute, if your blood, okay, is able to clot much more readily, okay, is that actually because you have what we call bradycardia, is that blood may clot in your vessels just from being asleep, because you have much, how can I say, less of a resting heart rate in your sleep. This is actually known to happen with cyclists who abuse EPO, so not testosterone, but EPO, the actual peptide hormone EPO. They use it to attempt to evade drug detection. Okay, and they use it very cleverly. They pack their red cell count, all these very very, very impressive things to get around the testing. And it has been known, as I say, that people may get blood clots in their sleep and die. So please, Anabolic androgenic steroids, over these past few videos I have covered, okay, they all do pose serious harm, okay, if they are abused at the truly abusive doses, especially with the polypharmacy. As I said, I just want to reiterate is that if you abuse polypharmacy, okay, risk does not necessarily scale linearly, okay, it potentially scales exponentially. The more drugs you take at the higher doses, okay, for too long, these are all factors of risk. Okay, so there we go. Clozapine, vitamin out.